Weekend.
Welcome back to The Weekend. I'm Ed Kalegi. Your tongue is sending you messages right now. Messages about your health. Here to talk about it is a speech-language pathologist specializing in myofunctional therapy and also the CPO of SpotPal. It is great to say hello to Toni-Ann and Antoniato. Toni-Ann, welcome to the show.
Thank you. Thank you, Ed, so much for having me.
It is great to have you on. I always wanted to have a discussion on this show about the tongue, and here we are doing it right now. So let us start with a definition. Everybody pretty much knows what speech-language pathology is, but what exactly is myofunctional therapy?
Yes, such a good question. So myofunctional therapy is a type of treatment plan where we are working to get the muscles in the mouth to function correctly. So it includes getting the tongue stronger, getting the tongue to swallow correctly, getting the tongue to rest correctly, and also getting the tongue to be placed in the correct place for specific speech sounds.
So if someone has a speech problem, they can't pronounce something that I did when I was a kid, and we'll talk about that a little bit later, it can be something much more than just the prototypical quote-unquote lazy tongue, can it not?
Absolutely. There can be an underlying cause as to why that individual is having trouble with certain speech sounds. And part of myofunctional therapy is identifying what that underlying cause is. And instead of trying to just target the symptom, which could be that expressive speech difficulties, we are instead targeting that underlying cause.
Now, the overall idea of the tongue and tongue health, and I teased our segment at the beginning by talking about how our tongues are sending us messages all the time about our health. A pink tongue, Toni-Ann, typically indicates good health, but there are other things that can come up if you have some other appearances or if you have a buildup on the tongue. Take us deeper into that. What are some things that we can kind of figure out or kind of get an idea about just by looking at our tongue?
Yes. So like you said, a pink tongue is usually an indication of a healthy tongue. However, based on the color and texture, if it is not pink, that can be a very important health indication. So, for example, if you look at your tongue and you see that there's some redness to the tongue, that could be an indication that you are suffering from some allergies or infection at that moment. You could also look at your tongue and see a blistered tongue. A blistered tongue can actually be a reaction that is a negative reaction to a medication. So those blisters can be indicating that. You could also see white patches on your tongue. White patches on the tongue can be an indication of a fungal infection. And then you could also look at your tongue and it could look too smooth in appearance. And when we see a tongue that is looking a bit too smooth, that can suggest mineral deficiencies. So the tongue, absolutely, what it looks like and the texture of it can tell us a lot about our health at that moment.
You know, it's very interesting. As you're talking about that, I think about perhaps the one medical professional that sees our tongue more often than anyone else, and that's usually our dentist every 6 months when we go in for our cleaning. And I guess I can't figure out the fact that if our dentist sees our tongue so much, wouldn't it be nice if when he or she sees perhaps that thick coating on our tongues, maybe he suggests we go see our general practitioner or even a GI doctor. Wouldn't it be nice if our dentist clued us in on what they see on our tongues?
Yes, absolutely. And I'm sure, many dentists do, and they're part of that dental exam is not only just looking at the teeth, but looking at the oral cavity as a whole. And yes, you should absolutely be able to rely on your dentist to give you that recommendation to see your primary care physician.
All right, September 13th, I actually have a dental appointment, so I'm going to say, Doc, what does my tongue look like while I'm here? So I'll make sure that he does his job that day.
Perfect.
All right. Well, Toni-Ann, in terms of us trying to achieve the best tongue health that we can, what is the best way for us to clean our tongues?
Good question. So we should always brush our tongue when we are brushing our teeth. So, we brush our teeth, and then we should also be brushing our tongue. They have those scrapers that you can use on your tongue. You want to really take care of the tongue. You want to do oral rinses. You want to pay just as much attention to that tongue in terms of cleaning it as you would the teeth.
I had a tongue scraper once, and my wife said, you better not use that because you're going to rip your taste buds apart. Now, obviously, my wife is not a medical professional, but she scared me that night after I just purchased this shiny new tongue scraper. Can you damage the taste buds by simply scraping or brushing your tongue?
You should not be putting that much force to do any damage, and those tools are designed for that. So that's why it would be better to utilize the tools that are correct for that than trying to use something else that could do the same purpose. So you are safe to use those tools that are meant for your tongue.
Very good. I saw this in the notes as I got ready for our conversation, and it shocked me. Toni-Ann, it said, on average, a person's tongue measures approximately 4 inches in length, though the longest recorded tongue has been twice that size. That's 8 inches. Toni-Ann, I have to ask, how does somebody walk around with an 8-inch tongue in their mouth? It's like going to Waldbaum's, buying a quarter pound of Virginia ham and carrying it around in your mouth the rest of the day. How does that even work?
So you need to have a lot of good tongue strength in that tongue so that if you are someone with a longer tongue, you could keep it up in the palate, or that's the roof of your mouth, which is where it's supposed to rest, and you'll be okay.
Do you realize now how many people across America this weekend are now going to be running for the rulers and measuring their tongues to see how they stack up with the average and the longest one ever recorded? That's just a part of doing a show like this. Here's another interesting one, too. Toni-Ann, this might seem a bit odd, but is it possible for people to learn how to roll their tongues?
There are lots of things that you can learn to do with your tongue. Myofunctional therapy is part of that. We, teach different exercises and different positions that you could put your tongue in. There are some people who believe that there are specific positions like rolling the tongue that are more genetic, that you can either do or can't do. But you can definitely get that tongue to do a lot more than you think with good exercises, myofunctional therapy, and strengthening that muscle.
I think about when we are young, and that is when our parents notice that we may have a speech problem in one way, shape, or form. And so in terms of speech pathology, I had a speech therapist when I was 5. I could not pronounce E-R, as in darker, hotter, etc. I sort of dropped the sound and it came out eh. And it sounded a bit aristocratic, like Major Winchester on MASH or former New Jersey Governor Tom Kaine, who would always say New Jersey instead. But finally, someone told my parents that I didn't need to sound aristocratic at 5, so I needed help. So they took me to a speech therapist, and that therapist cured me by having me say the sound while I balanced a Cheerio midway on my tongue. So I have to ask, Toni-Ann, are most speech problems cured as easily? And how difficult is it to address and cure speech issues with children, especially young children?
Such important questions. So first off, what you did with that Cheerio, that is some myofunctional therapy. So you may not have known it at that time, but your speech pathologist was doing some myofunctional therapy with that Cheerio on your tongue and trying to get you to make that sound. The earlier that we can target speech deficits, the better. So it's never too soon. There are speech sound errors that are typical and developmental, and they're part of growing up. A 2-year-old is going to have a hard time producing every sound in their language because they're still developing. But typically, if you are seeing that you're having difficulties understanding your child, especially as the parent, that could be a very good indication that you should have an evaluation, because there are a lot of those underlying causes that we spoke about that should be outgrown by early toddlerhood. So, for example, we're all born with what's called a tongue thrust swallow. And what that is, it means that your tongue is going forward to your teeth or between your teeth as you swallow. However, we're supposed to outgrow that tongue thrust swallow by early toddlerhood. And if by 3 years old we're still swallowing with that tongue thrust swallow, that's a good indication that we could have underlying causes related to why we're having trouble with certain speech sounds and should be evaluated and assessed for treatment.
So it really is something that parents should take good notice of. And I never knew that. And because of myofunctional therapy and a Cheerio, here I am. You may be talking to somebody totally different if my parents didn't address that and if they weren't Cheerios back in the early 70s. You are also the CPO of Spot Pal, and I find this incredibly interesting. Toni-Ann, tell me what Spot Pal is and what it does.
Perfect. So Spot Pal is a custom fit tongue training appliance. So it is designed to fit exactly to the user's teeth or dentition, and it is developed to work on strengthening the muscles of the tongue. It's going to help a user achieve the proper tongue resting posture of their tongue. Again, as I mentioned, that tongue should be up in the roof of your mouth. So as you sit there and you're not speaking and not eating, you should feel your tongue lightly suctioned up to the roof of your mouth. That is proper tongue resting posture. Spot Pal will also work to eliminate tongue thrusting and prolonged sucking habits. And then Spot Pal also promotes nasal breathing, which is so important across the whole lifespan, that we are breathing through our nose and not through our mouth.
Toni-Ann, what has been the response to Spot Pal thus far?
It has been amazing. It has been a very busy year. So we had kept Spot Pal exclusive to our speech private practice for about 2 years, just over 2 years, because we were developing it and we wanted to keep our eyes and hands on the appliance and on our patients. Just of January 2023, we put it out to the public and to the masses. We've been to dental conventions, orthodontic conventions, we've been to myofunctional conventions, and the response has been better than we could have hoped. It's been so amazing.
That's great. You can learn much more about Spot Pal at thespotpal.com. Toni-Ann, I am a curious person by nature, so I have to ask this because you sound as if you love what you do. What made you want to become a speech-language pathologist and myofunctional therapist in the first place?
So I didn't know what I wanted to do when it was time for undergraduate school. And the college that I went to, a speech class was a core class that we had to take. And as soon as I took that class, I fell in love with it. I knew it was what I wanted to do. And I'm so thankful for that, because as a professional now in the field and being able to do myofunctional therapy, I have been able to help support my own children, because now as a mother, I was able to identify deficits early, right when it's ideal time to do so, and evaluate and get my own children in treatment and get them to have proper tongue strength and proper tongue resting posture to produce certain sounds correctly and to be able to get them functioning the way that that mouth is supposed to be.
How cool is that? That is wonderful. Toni-Ann, where can folks find you online and on social media?
Absolutely. So we are thespotpal.com, and you can find us on Instagram, TikTok, Facebook, all those fabulous social media platforms, all at thespotpal.com.
We've learned about all things tongue, and I can finally cross that off the bucket list of things I want to talk about on the show. So this is great. This has been very informative. I've enjoyed this very much. Toni-Ann and Antoniato, thanks so much for joining me here on The Weekend.
It has been such a pleasure. Thank you so much for having me.
You got it. Stay with us. More to come. I'm Ed Kalegi, and this is The Weekend.